Hi, I'm Legina Hodry, and today I'm presenting a strategic plan for improving clinical decision support at our organization. Specifically, I'll focus on the use of risk stratification and predictive analytics as a way to go beyond our current alert-based system. This presentation is designed with you, the stakeholders, in mind: clinical leaders, IT professionals, and decision makers who need to know how these tools can improve quality, efficiency, interoperability, while also ensuring value for the patients and the organization. Clinical decision support, or CDS, refers to tools that give clinicians evidence-based, patient-specific guidance at the point of care. Right now, our CDS is limited and often creates frustration because of alert fatigue. Our objectives today are threefold: evaluate the limitations of current CDS, propose risk stratification and predictive analytics as a solution, show how this approach improves patient outcomes while meeting interoperability requirements and organizational goals. By the end of the presentation, I want you to have a clear picture of how we can implement CDS and not only support clinicians, but also generate real value for patients, leadership, and payers. The guiding question for this project is straightforward but critical. How can predictive analytics-based CDS reduce inefficiencies, improve outcomes, and enhance interoperability compared to the current alert-heavy system? This question forces us to look at both quality and efficiency. On one hand, predictive analytics helps clinicians focus on patients who need attention the most before complications arise. On the other, it helps the organization reduce waste, avoid penalties related to readmission, and align with regulatory programs like promoting interoperability. For this project to succeed, we need to think broadly about stakeholders. Physicians and nurses are the frontline users. They need CDS tools that are accurate, timely, and seamlessly integrated into workflows. Patients, they benefit through safer care, better engagement, and fewer unnecessary hospital visits. IT and informatics teams ensure the system works across platforms, building data from labs, pharmacies, and electronic health records without disruption. Executives and payers want to see measurable returns, improved ratings, reduced admission penalties, and sustainable value-based care models. Each of these groups has different priorities, but predictive analytics can address them collectively. Currently, our organization primarily uses basic drug-to-drug interaction and allergy alerts. These tools are useful, but they have become a source of clinician dissatisfaction due to high false positive rates. What we're proposing is an expansion of predictive tools, including readmission prediction models that identify patients at high risk of returning within 30 days, population health dashboards that highlight care gaps and manage chronic disease more efficiently, risk scores integrated into the EHR, allowing clinicians to see a patient's status in real time, preventative care algorithms that prompt providers about overdue screenings or interventions. Together, these tools shift CDS from being reactive, stopping in order, to proactive, anticipating the patient's needs. Predictive analytics-based CDS offers multiple benefits. Early detection. By identifying high-risk patients earlier, we can intervene before conditions escalate. For example, predicting deterioration in heart failure patients allows us to adjust treatment before hospitalization. Reduce readmissions, a critical financial and quality metric, as avoidable readmissions are costly and can trigger Medicare penalties or other insurance penalties. Improved care coordination. These tools guide care managers and nurses to focus resources where they really matter most. Personalized medicine. Models take into account not just the diagnoses, but lab values, comorbidities, and sometimes social determinants of health. Cost savings and efficiency. By preventing adverse events and unnecessary admissions, predictive CDS directly supports financial sustainability. Found that when clinicians rely on well-designed decision support outcomes and safety improves significantly, the evidence tells us that this isn't just a theory, it's practice with measurable results. When developing predictive CDS, we must ensure all aspects of patient care are considered. Clinical, social, and behavioral determinants should be incorporated, recognizing that non-clinical factors often drive outcomes. Multiple data sources, including pharmacy, labs, claim data, these must feed into the model. Patient-centered design is key, ensuring that CDS prompts are meaningful, not disruptive. Clinician usability must be prioritized, otherwise the adoption will fail. And finally, privacy and security protections are non-negotiable. Given the sensitivity of predictive modeling data, it's a must. It is emphasized that implementation success depends on respecting these human, organizational, and technical factors. Our CDS implementation team will need to prioritize carefully. First, address false positive alerts to restore clinician trust. Pilot predictive models in high impact areas, like readmissions, where improvements have both clinical and financial impact. Ensure integration with EHRs for seamless workflows. Deliver comprehensive training for clinicians so they understand and trust the models. Commit to continuous monitoring and refinement of the models, using real-world outcome to improve accuracy. This stepwise approach allows us to demonstrate value early while building momentum for broader adoption. To guide this work, we can draw on several theories. Learning theory, which emphasizes the role of training in ensuring adoption. information theory, which highlights the importance of effective, accurate data flows, system theory, which focuses on the interaction of people, processes, and technology. While all are relevant, system theory is most appropriate here. Predictive analytics isn't just about an algorithm, it's about how the algorithm fits into the clinical system, the data ecosystems, and the workflows of clinicians. System theory ensures we are not just implementing a tool, but an integrated solution to connect human judgment, organizational needs, and technical capability. In closing, risk stratification and predictive analytics represent a significant opportunity to transform our clinical decision support strategy. This approach reduces inefficiency, improves outcomes, and aligns with federal promoting interoperability requirements. It benefits every stakeholder, clinicians, patients, IT teams, and leadership. With the system theory as our foundation, we can implement the solution in a way that is integrated, sustainable, and scalable. By adopting predictive analytics and CDS, we position our organization not only to meet today's demands, but to prepare for the future evidence-based, data-driven healthcare.